situation and with a higher risk of transmission of the pandemic, we need to strengthen the health monitoring and early intervention so as we would be able to implement the early detection, early transfer, and early treatment for the supermarkets, logistics, catering services, transportation services, personnel need to strengthen the personal protection and to do a better job of self-health monitoring. And they need to report the symptoms on a timely basis. So today we have the topic of the key institution, key groups, pandemic control. We have with us Mr. Li Banghua from the Ministry of Civil Affairs, Madam Li Jian, the first inspector of the Social Governance Department, Mr. Geng Hongzhou from the Consumer Department of MOVCOM, and also Mr. Bian Zuodong from the State Post Bureau, and Madam Chang Zhaohui from the CDC. And we would like to answer the questions now. So, the first question. From Zhongxinshe. So recently, the State Council Interagency Task Force has issued the operational guidelines for the prevention control in the care homes. So what are the specific requirements for the prevention and control of the pandemic in the care homes? What is its main essence and what are the key points? As we all know that everybody is paying great attention to the pandemic prevention control, the guideline, as you have mentioned, is implementing rules for the implementation of the categorized B category and B class management spirit. Actually, it has 4 basic points. Firstly, we are going to adapt more stringent requirements for the care homes compared with the community prevention. That is to say that under the prerequisite of strengthening the health monitoring of the incoming and outgoing personnel, if it is approved, then gradually we will adopt a more open approach in the management. So for the care homes, as we know that we will have to adopt a more stringent management mechanism in the care homes to protect the life and health of the senior. That is why we need to strengthen the protection of the key groups for the key institutions. And second point is that we would like to stress the optimized adjustments on a dynamic basis, whether the care homes should adopt a closed loop or an orderly open management method. We believe that the local mechanism should make a scientific assessment based on the pandemic situation in the locality, also taking into consideration of the spreading of the disease as well as the prevention control that has been adopted for the care homes, as well as the medical resources workload and on such basis, a dynamic adjustments should be made, and all these measures are made for the prevention of super spreading. And thirdly, we need to prevent the spreading of the disease as well as prevent the risk of transmission. That is to say, the guideline has given a very detailed requirements in case that the external sources of infection has been accidentally introduced into the care homes. And fourthly, the priority in the provision of the medicines and access to the treatment has been strengthened. The guideline has required the care homes to adopt a categorized and tiered healthcare service. So when the seniors have some severe diseases, they would be able to treat it on a timely manner. So when the pandemic control has entered into a new stage and in the perfection of the prevention control in both rural and the urban area, how can we fully mobilize the capabilities of the public? The community prevention is for the sake of the public. Of course, we need to depend on the public, and during the responses of the pandemic, the forces of the public is formidable. Under the leadership of the party organization of the community, we can effectively mobilize and organize the public in building a prevention control community. So first of all, we believe that the party organization and villagers committee as well as the health service organizations in the village should be given a full play, and the accountability of the villager groups, community, neighborhood groups, such an accountability system should be put in place. And in the rural areas, the 5-tiered party secretary mechanism should be put in place so as to further optimize the pandemic prevention control mechanism. And secondly, we need to accelerate the promotion of the public health committee's full coverage. Since December of 2021, Ministry of Civil Affairs and other 4 departments has jointly made a deployment of the building of the public health committee construction. Actually, till now, more than 90% of the villages or the communities have set up their own public health community. So nextly, we would like to strengthen the public health communities' role with that of the other organizations so that they would be able to have a coordinated effect in an efficient way. And thirdly, we believe that the coordinated mechanism among the community organization, the personnel in the community, the volunteers, as well as the charities, so as to optimize such a voluntary service system, we should mobilize the public to offer help to their neighbors in a mutual way. And fourthly, we should organize the public to be part of the consultation process in the prevention control, so the resources of the public can be fully utilized in the implementation of the optimization of the prevention control. From CGTN. So after implementation of the categorized B class management, so what are the new requirements for the community prevention in the rural and urban areas? After the B category, B class management, as we know that for the key places as well as how can they implement such response measures has been incorporated into the guideline. So for the key places would include the care homes as well as service institutions and mental institutions, the public and fast delivery services. Well, for those key places, it would include the catering services, services providing bathing, and these places are prone to cluster infections, so they should have a accountability system to make a better personal protection, health monitoring, the disinfection of the environment, ventilation, and etc. For the care homes and the warehouses where vulnerable groups are congregated, the following measures should be taken. First of all, they should have a division of the zones, and secondly, sometimes a closed-loop management should be adopted, and thirdly, the external personnel should make an appointment before gaining access to the key places, and they should also provide a 48-hour PCR test. Fourthly, such a green track, fast track treatment should be set up.
The next question, please. Thank you. So the second female journalist on the third row on the left quarter. Welcome. Thank you, Ms. Moderator. I'm from Jiangsu Broadcast TV. The question is that the drug-based has been a rigid demand for the general public. So my question is that the National Drug Administration, what kind of plan do they have for the courier and delivery of pharmaceuticals? Indeed, the medical supplies, especially the medicine drugs, have been in high demand. When it comes to the transportation and delivery, the central government, the Central Party Committee, as well as the State Council, have been paying a lot of attention and has done a lot of planning. The postal services has been mainly mandated to provide personal delivery, as well as the delivery of the medical supplies purchased online, including the N95 masks, as well as antigen kit. So currently has been a huge amount of orders, as well as the deliveries. In order to guarantee the supply and delivery of those medical products, we have done the following work. Well, firstly, we've been putting together the endeavors of different agencies. We've been working with Ministry of Commerce to convene a meeting of the delivery businesses as well as the e-commerce businesses to organize some conferences on the basis of understanding the issues. We have working with MOFCOM to jointly promulgate a circular with regard to the guarantee of the supply of medical products, medical supplies. Also, effective measures must be taken to make sure that the drugs will be delivered. Well, secondly, we shall give priorities. We have urged and guide the postal services and other courier services to put special labels and marks so that they can receive the priority in terms of delivery, so that the medical supplies that the general public has special needs will be delivered in their hand. The first thing. Well, thirdly, we must adhere to the issue-oriented direction. We have urged the postal and courier services to conduct dynamic monitoring as well as special monitoring. So the companies must set up a special task force and team to identify the issues of the delivery of such supplies. If in the process the medical supplies and pharmaceuticals will be lost or destroyed, we have urged the companies to purchase similar products to satisfy the needs of the users and serve as priorities. Thank you. Next question, please. So to the first row, the second row, the male journalist on the left portion. Thank you, Ms. Moderator. I'm from People's Daily. Ever since the Class B administration of Class B classification of COVID-19 as the Class B infectious, what kind of new requirements for the urban and rural areas, community pandemic control? Well, thank you for your question. My name is Li Jie. Over the past 3 years, the communities at both urban and rural areas have been following the decisions, policies of the central authorities by building the barriers of preventing the pandemic control. Ever since the implementation of a Class B administration, we have entered a new phase, but it's still a very critical stage. We need to focus on the objectives of guaranteeing health so as to prevent critical disease. We need to shift our focus or priorities to the self-governance function of the communities so that the transition will be very smooth. In recent years, with the consent of the interagency joint prevention and control mechanism, Ministry of Civil Affairs, Ministry of Agriculture and Rural Areas, the National Health Commission, as well as the National Disease Control Administration have promulgated a circular with regard to the pandemic control on the basis of Class B administration, so that we can do a better job of COVID-19 prevention at urban and rural communities. We have clarified the requirements that the communities must constantly perfect their pandemic control system. We need to, all the pandemic measures will be implemented at the villages or the residential compounds. We need to provide the health needs and services on the classified basis to guarantee the needs of the critical populations or priority populations. We need to respond to the needs of the public very promptly so as to satisfy needs of the public. Also, we need to do a better job in terms of education and the communication to guide the population to have a scientific understanding of the virus. We must make sure, we must try to communicate the idea that everyone should be responsible for themselves in terms of their health. We need to care for the healthcare providers and other social workers in the community to incentivize, stimulate to do a better job in terms of pandemic control. Going forward, the full agencies, including Ministry of Civil Affairs, will be under the leadership of the Joint Prevention and Control Mechanism to implement the measures of that circular so as to further build the pandemic control mechanism, the rural and urban communities to do a better job so that the control measures will be more precise and warmer for the public. Next question. The right quarter, the third row, second journalist. Thank you, Mr. Moderator. From today's daily, I have questions to Director General Ge. We know that during the Chinese New Year period, there is a huge traffic for the shopping mall and the supermarket, as well as the groceries. What kind of measures has the MOF come down in terms of prevention of the pandemic during the Chinese New Year? Thank you for your question. Obviously, we know Chinese New Year is the most important traditional holidays for the Chinese population. Obviously, it represents the peak period in terms of consumption. People will purchase a lot of groceries to spend a quality Chinese New Year. Obviously, that means huge traffic for the shopping mall and the supermarket. We at the Ministry of Commerce will follow the master plan of the Class B administration to implement and optimize the pandemic control measures. In so doing, we have drafted the relevant guidelines operation for shopping mall, supermarket, rural products, groceries. For the pandemic control in those regions, we have clarified the requirements of specific pandemic control, the hygiene of the environment, as well as the health prevention of the staff, so as to guide the relevant industries to a better job in terms of pandemic control. Well, firstly, we need to increase the prevention and protection of relevant staff and personnel. All the employees must conduct self-health monitoring. When the relevant symptoms emerge, they need to report to the relevant authorities as soon as possible and to conduct the antigen or nucleotide COVID test. The relevant employees must be vaccinated or receive the relevant boosters as much as possible. Also need to wear a mask as well as the disposable gloves as well as other protection supplies. We also need to guide the consumers to wear masks properly, but they don't have to take temperatures or check their health score. Well, secondly, we need to do better job in terms of disinfection of the relevant environment for all those shopping mall groceries. Ventilation must be guaranteed. They need to open the window to have the ventilation for 2 or 3 times. For all those shopping mall as well as supermarkets, must be sterilized or disinfected for at least 2 times every day. The relevant garbage must be disposed of as soon as possible so as to guarantee this infection outcome. Also, the groceries must conduct the centralized disinfection and cleaning so as to maintain the overall health and hygiene of the public zone. All these different stands must fulfill the needs of daily disinfection. Also, we need to encourage the countless services. We need to encourage the consumers and customers to make the payment by scanning your QR code so as to reduce the contact as well as the time of the curing. And we encourage the online and in-person combination so as to provide the retail as well as the delivery by order online. Another journalist. I'm from CCTV. We know that nursing home, caring home has always been the priority for pandemic control. We understand that during the Class B phase, that how the Ministry of Civil Affairs and the relevant departments will guarantee the minimum infection in the nursing homes. Thank you for your question. The prevention of critical diseases has been the priority for in this stage, including the nursing home.
Most of the seniors are those who are incapacitated senior or with underlying diseases, so cluster infections may occur in such types of scenario when there are any infections, and there is also a high possibility for the seniors to catch severe diseases. So the Ministry of Civil Affairs, based on the guideline of B category and B class management, together with the CDC, we have been trying to take preemptive measures under the guidance and the principle of protection of health and prevention of severe diseases. So first of all, they would monitor the care houses to have antigen or PCR test at least twice every week. If the care homes have any difficulties in contacting such PCR tests, then the local interagency task force should be able to provide such coordinations to make sure that the early detection of the seniors of being infected or being tested positive can be identified as early as possible. And secondly, the classified and tiered health monitoring service should be provided to the senior to make sure that the care homes can be provided with the oximeter and the oxygen generators and the labeling of yellow and red upon the key risk personnel should be conducted to make sure that the early identification of the senior would be able to implement it. And thirdly, the medicines should be prepared in the care homes, and the telemedics as well as services provided door to door to the care homes can be made. So the early prevention among the infected senior would be made. And fourthly, for the transfer mechanism and the green track among the infected in the care homes should be really very efficient, especially when we have no beds in the designated hospitals or when the medical resources are overstretched. The Civil Affairs Department and the Health Department should strengthen the coordination to make sure the early transferring of the seniors when they are being infected can be conducted duly. So the Paxlovid produced Pfizer is not being able to put into the health insurance list after the negotiation. So would it have any influence to the guarantee of the drugs to treat the coronavirus infection? Actually, the Bureau of Health Insurance have been paying great attention to the drug usages. Actually, after the outbreak of the pandemic since 2020, all those drugs had been previously incorporated into the medical insurance catalog, and for each year we will have an update of the drugs which are used to treat such COVID. As you have mentioned about the negotiation of the Paxlovid, actually there are 3 types of drugs which are under the discussion. It includes Paxlovid as well as azafudine and as well as the lung cleansing and detoxic granulars, but because of the very high pricing strategy of the company, Paxlovid was not able to put into such a catalog. However, you don't need to worry about it too much because a new guidance had been issued on the optimization of the pricing, especially of those drugs which have been failed to be incorporated into the catalog. So before the 31st of March of 2023, temporary payment will be covered by the medical insurance. And also there are over 600 different types of drugs treating fever, coughs, and other symptoms of the coronavirus infection. I have also noted that some new drugs had been launched to the market. We do believe that with the further launch of the new products, the patients will have more choices of such drugs, and the Bureau of Health Insurance will pay great attention to the prices of the drugs and monitoring the drugs of prices to make sure that the cost for the treatment is well controlled and to reduce the burdens of the public in treating their own diseases. Just now you have mentioned that for the key organizations and key places, other than implementing the routine response measures, when there is infection, we also need to take very effective measures. I believe for these key institutions and key places, how can we make sure that we can have early detection? The Omicron variant is featured by fast transmission. With the key institutions and places, it is featured by the gathering of the population. So once there is infection, in a very short period of time, it may have the risk of transmission. It may also have a great impact to the seniors. So under the prerequisite of implementing the response measures, the health monitoring and antigen PCR test should be conducted, which are definitely the key of the early detection of the pandemic. And for such key places like care homes and welfare houses, our PCR test should be conducted on a timely basis. And secondly, sometimes closed-loop management shall also be conducted. So we would be able to identify the disease as early as possible by conducting the PCR and antigen test. So we believe all these measures are very effective for the early detection of the disease. From South Daily. Currently, we have already implemented the B category, B class management for the corona infection. So what types of optimized adaptation has been made in the postal and the fast delivery industry in the response measures? After the outbreak of the COVID-19, the State Post Bureau have been implementing the deployment and the decisions of the central government as well as the State Council. And we have also implemented the requirements of the State Council Interagency Task Force. And based on the current changing dynamic of the infection, we believe that it is a time for us to make adaptation in the implementation of the categorized B class management. So some optimized measures would be implemented. So first of all, the accountability system of the postal and fast delivery companies should be put in well place. The trainings, health care protection, and the security management in the workplaces should be well conducted, while at the same time we should further implement the responsibility of supervision and monitoring of the relevant departments to make sure that the industry watchdog will have a very positive role in the resumption of work and life. And secondly, we need to make sure that the personnel should be the first responsible person for its own health, and the personal protection awareness should be strengthened, and the health monitoring, the symptoms management should be well conducted. The vaccination should be further administered, while the companies should also offer help to the infected so that they would be able to resume back to their health.
So sadly, we have required the relevant businesses to strengthen and enhance the day-to-day public health management and hygiene protection for their operation centers and network. They need to conduct regular disinfection and ventilation. For the employees' failure to be on duty due to infections, they need to do a better job in terms of the coordination as well as the shift transfer, as well as the guarantee of the pandemic prevention supplies. When there is the failure of showing up, again, they need to do a better job in terms of preparing the stand-up teams so as to minimize the adverse impact of the pandemic on their normal operations. Well, firstly, in light of the new situations, we have suspended the previous more stringent control when the coronavirus pandemic was under Class A control. Basically, we have removed the relevant disinfection when the courier packages were imported from overseas, as well as optimizing some of the links so as to increase efficiency. Next question, the third row up to the right quarter. Thank you, Mr. Moderator. I'm again from CNTV. We have noticed that in some warmer areas, when temperature has risen, some certain segment of population already stopped wearing masks. So the question is that when the new measures have been put into place, is it still necessary to wear masks? What other control measures for population in the public? Ms. Chan already visited the question. Thank you for the question. Well, currently, the COVID pandemic is still at different phases during different parts of China. Therefore, it's still necessary to emphasize the individual protection, especially the mask wearing, especially under the following circumstances is absolutely necessary. For example, when people enter hospital, when they're in the supermarket or shopping mall or indoor meetings or other indoor settings such as the train station or airports. So any public spaces with high density of population, or when they're wearing public transportation means or elevator, or secondly, when they enter a nursing home or other social welfare institution when vulnerable populations are present, or thirdly, when the relevant people have the symptoms of fever, coughing, also third, also when they have a close contact of the infected population, or fifthly, the people engaged in the profession such as healthcare, transportation, shopping mall, restaurant, tourism, and courier services. Also, in public setting, we need to maintain social distancing, the matters of coughing, ventilation, disinfection, as well as cleaning. Therefore, each person has his or her own duty responsibility to prevent and stop the infection of virus pandemic. Details are very important. With the two last questions, again, the left zone, the second row, journalist by the L. Thank you, question, and from the China net. The social worker of community at both urban and rural areas have played an important role in pandemic control. When we have the Class B control, how can we further guarantee the protection of the priority population? Ms. Li Jian, please answer the question. Thank you for your question. Assisting the vulnerable population, like the senior citizen as well as children, which are obviously priority population, have been the important priorities for the communities, both urban and rural communities, in terms of prevention of pandemic as well as critical diseases. We need to do the following three key aspects of work. Firstly, we need to understand the health status of the priority population. We need to strengthen our communication with those vulnerable populations. To understand their health situation in a dynamic manner, we need to rely on social media such as WeChat to have frequent contact with the priority population and as well as their families. For those senior citizens who doesn't have this online communication, we need to knock their door to have in-person communication with them. We need to visit those people along with the healthcare workers on the grass level so as to understand their health situation, their needs for medicines as well as service, so as to build solid fundamentals for providing targeted health care services. Well, secondly, we need to assist the critical population in terms of their health services. For those vulnerable populations, the health services should focus on the need of seeing a doctor, medicine administration, as well as vaccination. So we really need to strengthen our communication with general practitioner, healthcare provider on the grass level, as well as the pharmacists, the relevant communities, as well as the agencies in charge of the vaccination, so that we can do a better job in terms of the online diagnosis, delivery of the medicines, transfer to hospital, as well as the encouragement and advocacy of vaccination. Also, we need to organize the mutual help within the community to set up this pharmacy sharing mechanism so as to guarantee the population need for the relevant medicines. For thirdly, we need to do a better job in terms of the communication and the education, relying on social media such as WeChat, public account, the smart community client services, as well as other community services. We need to do a better job in terms of the bulletin, as well as the loudspeaker in the rural areas, so as to conduct the relevant communication education of the scientific medicine administration, as well as the convalescents at home and other pandemic control common sense, so as to guide the population to scientifically and rationally realize and know the actual work of vaccination and the virus control. Also, when Class B administration is put into place, the social worker at the grassroots level communities shall continue to be the guardian of the health of the people, to be fully motivated and incentivized to proactively identify the actual hardship and difficulty of the people. The grassroots level governments and relevant agencies should provide the support and guarantee for such work. The relevant resources shall be devoted with emphasis to the grassroots level communities. We need to set up this mechanism within the community and the relevant pharmacies. The issues must be properly resolved. Feedback must be handled so that the communities will be organized and optimize their work so that they can devote more effort to meet the needs, difficulties of people at the grassroots level. Last question. On the left quarter, the third row, the third journalist. Thank you, Ms. Moderator. I'm from Red Star News. So, for next step, how Ministry of Civil Affairs will guide the local governments and communities to implement these operation guidelines of carrying home COVID pandemic control measures, as well as the relevant requirements from this interagency joint mechanism when it comes to the nursing home pandemic control. Mr. Li Banghua, please, the question. Thank you for the question. Like I said, that guideline, priorities have already been explained by me just now. Nextly, the priority is to implement those measures on the ground. We, at the leadership of the Ministry of Civil Affairs, have taken the nursing home pandemic control very seriously, according to the Class B administration measures. And based on the decisions made by the Central Authority State Council, will mainly focus on the following four aspects of work. Firstly, we need to enhance the organizational leadership. We need to promote all different localities and provinces to follow our guideline. They need to set up this joint mechanism with the government has as the person in charge. The civil affairs agencies, the healthcare authorities, as well as disease and pandemic control should set up this joint mechanism to solve the relevant issues for the nursing homes. Well, secondly, we need to put into place the specific requirements on a granular level. We need to guide the civil affairs authorities to follow the requirements of the guidelines as well as the requirements of this the interagency joint mechanism to draft specific implementation rules based on the specific details and realities on the ground of the specific region, so that to make sure that all those requirements will be actually executed on the ground. Well, certainly we really need to do a better job in terms of guiding and urging at the level of the Ministry of Civil Affairs, as well as the Departments of Civil Affairs at the county level. We already have set up this daily coordination and dispatch mechanism, which means that we need to understand the pharmacy needs as well as the healthcare needs of the nursing homes on a dynamic basis. We need to guide the civil affairs authorities at different regions to coordinate the relevant resources to provide solutions. We know during the Chinese New Year, before and after Chinese New Year, there's a lot of migration of people and transportation of the workers. So problems may give rise. So we really need to shift priorities to the pandemic control for those nursing homes in the rural areas. We need to incorporate the caring home of the rural areas into this village level insurance and guarantee mechanism, relying on the clinics on the county level to build this fast-track solution mechanism.
And fourthly, we need to strengthen the relief for the care homes and for those care homes which had been implementing a closed-loop management for a very long period of time. Such a rotation of the personnel should be conducted, and also such caring should be provided to both the senior and also the personnel in the care homes, and some psychological comforting should be provided to all of them. And we would also like to encourage the charities to help the care homes to have a better pandemic control and response. So we would like to, indeed, so today's conference have given us an introduction of the COVID infection response in the key institutions upon key groups. So please keep tuned and to participate in the press conferences in the future. Thank you very much.